Usually, like if you guys purchase a automobile, you usually read the manual and get kind of an idea of how it works and how to take care of it, and or anything else. I don't care how they work, but most people care how their machines work, and so they figure it out. They study it and they take care of it according to its requirements. So, but still, they don't learn enough, so they got to take it usually to a mechanic or something. And it turns out that the most important thing that we've ever get on Earth is this body. This body happens to be the vehicle that allows us to go through the necessary experiences. Okay, without the body, we can't do it. So it's our Earth suit. It's very important. And we need to know how to take care of it. We need to understand it. Well, we don't need to. As you can see, we don't need to. And of course, there's no owner's manual. And so what would you think? I would think that a righteous society, civilization, would include as one of the primary teachings of the young would be your body, how it works, what it needs, all that sort of thing. So that as part of a primary education, you not only can read, do arithmetic, but you also know how to eat, you know why you exercise, you understand how your heart works, and all that. None of that happens at all. It's taught separately in very, our whole education system is taught in a way that makes you not want to learn. So, they're successful. So how many people, and you know how you can prove it, how many people read? 1%? No, 1%. Perhaps 1%.
Place where I'm staying, there's not even a decent reading lab. In the bedroom and the living room, nothing.
Right, you're right. People don't read.
It's not a book in the house.
It's interesting. It seems to be regional. When I was in New York, on the subway, everybody was reading.
Nobody would talk to anybody else.
Right. No, but there's a lot of readers there. Even though they're reading only novels, most of them are reading novels. But they're readers. Reading's lost. It's gone. So anyway, that's the result. So anyway, the whole purpose of this whole series is to teach you about the body, your body, how it works, and all that. Because our goal is that you all never, ever need another doctor the rest of your life. You don't have to take your car into the mechanic. Okay? Now, so we last time talked about, and so it's going to be the series. I don't even know how long this series is going to be, unfortunately. And those of you who will leave in the meantime, as we do, we'll send you the rest of the CDs or video, whatever they are. So just so you can. So basically, I don't know. So last time, and what does it start with? It starts with when you're going to talk about this wonderful earth suit. You have to talk about its shape. And remember, we discussed shape and function are like a front and a back. You can't separate shape from function. Function is a result of shape. Right? Opposing thumb, right, allows for certain function, right? Chimps, you ever see a chimp's foot? It allows them to grab onto branches and swing by their feet. We would have a little trouble with that. Okay, so it's function. Gills, how about gills? How about wings? How about eyes on the side of your head? Why do they have them on the side of their head? Why are they doing that? So, it turns out this wonderful thing is that this wonderful phenomenon known as nature is an absolutely perfect, incredibly perfect process. And everything we see, whether it's a leaf, a butterfly, a whale, or anything, is performing a function. Very interesting. So, and the shape has to do with it. So, we talked about anatomy. Anatomy is the description of form. And then we're going to include physiology. So, we talked about the basic anatomical positions. If everybody remembers, the basic anatomical position is like this, palms up. In men, the penis actually is up, so on the underside is considered ventral anterior. I don't know why they did that, but anyway, and we talked about this is medial, anything is lateral, right? Anything above is superior, anything below is inferior, right? My elbow is proximal to my wrist is distal to my elbow. We're talking about away from here. Okay, and when a joint closes an angle, it's flexion. When it opens an angle, it's extension. Right? When something moves away from your body, it's abduction, abduction. When you move towards your body, it's adduction. It's just the words. The reason you learn them, I mean, you might want to know them. It's just when a doctor writes in a note, they're going to say, "Oh, he turns his right arm to the left." He won't say that. He'll say lateral rotation 30%. The normal is 50%. Anyway. So that's what we went over, basic anatomical position, I think, last time, right? And what I want to go over, I want to take system by system, and I thought we'd go over the heart, the cardiovascular system, because and I don't know if we're going to do each system in such detail because I just don't know yet. Certainly not all of them in such detail. But the cardiovascular system is important. Certainly we're not going to go over the nervous system in detail. That's crazy. So, and it's not unnecessary. It's unnecessary. And the heart, we're not going to do in extreme detail, but one of the other things that should come about from the study of the human form and shape, function, and maybe we'll get down to even the biochemistry. One will allow you all who misuse the word awesome. Because believe me, I was with my son and he bought a pretzel. We went to this, we're at the mall. And I ordered a what was it? It was a pretzel. And she goes, "Can I help you?" And I said, "I have a pretzel." She said, "Awesome." Wow. I used to think awesome meant like a sunrise. Awe, you can't talk. That's awe. We have degraded awe. It's not awesome. None of this stuff is awesome. Anyway, but what is awesome is this body. What is awesome is nature. And that's what I hope you get an understanding of, an appreciation of, and a reverence for. And one last thing I want to say about in general is that the law, if we understand how this works, we understand its nature and its requirements, and we understand too that the laws of nature are non-negotiable. They're non-negotiable. Gravity always on this planet pulls you at 32 feet per second squared. It's just the way it is. And that's very important. So when we understand our biology and the requirements of nature, we understand. So guess what happens when you live according to your nature? It functions perfectly. And what's perfect, absolute, optimal functioning called? Health. It's really fantastic. So, anyway, the heart. Where's the heart? The heart is located in the chest, the thoracic cavity. Okay? About 2/3 of it is on the left side. Okay? It's oriented with the top part of the heart, which enters close to it just crosses the midline, is where all the blood enters and exits. The point of the heart is called the apex. The apex is oriented anteriorly. So, you know that, remember, anterior is this way, posterior is that way. So the heart is kind of like this. Okay, so this females, the breasts change it. But if you look at the surface anatomy, on a male, the point at which the tip of the apex is closest is between the 5th and 6th ribs. And that spot in there is called the PMI, the point of maximal intensity. And we feel for that usually. So if it's enlarged, that helps us understand that you're having a problem. If I find your point of maximum intensity between your 7th and 8th rib, I know you got a really large heart control. Okay, so that's that. So that's very important to know. That's where it is. It's in the chest. Now, how is it? How else can we describe it anatomically? Well, we can say that the lung is flanked laterally on both sides by the lungs. It is superior to the diaphragm. Remember, the diaphragm is what separates thorax from the abdomen. And it weighs about 250 to 300 grams. It's about 12, 14 centimeters long, 2.5 centimeters in an inch. So what? That makes it what? 5 or 6 inches? 5 inches long. So not a really big guy, right? So didn't we learn here in America that bigger is better?
You would think so, wouldn't it?
Huh?
You would think so when you look at people.
Well, that's because we no longer use the word fat. It's not polite to say you're fat. They're big people. What does that do? I'm sorry, I always digress just because it gives me an opportunity. If you notice that most of the people that are using handicap stickers and it's due to their obesity, have you seen that? They're too fat to walk. They're sitting in carts. They go around shopping. They go around the market. I watch them, and it's speechless. They're driving around in these cars. They're this big. So what have we done as a society? We have reinforced obesity, infirmity. We are saying, if you can get this big and this sick, we're going to give you a front row seat. You can get in anytime you want. So we got all these handicaps. They should put them at the end. The people that are healthiest should get the reward. That's not our society. We reward sickness. We also reward ignorance, stupidity. Ignorance, not stupidity. Ignorance is ignoring the truth. Anyway. So, but bigger is not better. The heart is an amazing little thing. I wanted to follow some notes here so I don't get too distracted. Okay. So before we talk about function, let me just say, the heart has basically 3 layers. The inside of it, that's in contact with the blood, that tissue is called endocardium. Endo always means in, cardium makes sense. The middle tissue is myocardium. M-Y-O, muscle. The outside tissue is epicardium. Epi means on top of, above. The epicardium, and you've got to know this in a little bit of detail. It's important. It's interesting too. The outside epicardium, there's a layer of fluid above it, and then you have the pericardium, which is another tissue, very thin tissue called the pericardium, and there's a liquid in there, kind of a viscous liquid. It's basically lubrication, because the heart's going like this, it's moving, and that keeps it from it prevents any friction, any problems like that. It doesn't run into anything. And in fact, in the body, anything that's movable will have some sort of way to mitigate the friction. So moving organs have a part of a very thin tissue that lines it.
Is that the fascia that she works on?
No, that's the fascia is different. Fascia is like sheets of fibrous tissue that separate muscle groups. Okay, and then they're very much similar to tendons, and tendons are that fibrous tissue which connects a muscle to a bone, right? And so a fascial sheath will encompass several groups. You know, and one of the problems in people that get like a skin infection, it actually gets down. If it goes deep enough or goes in the wrong way, when your body's you don't have a good immune system. If it gets into one of those fascial planes and you get a fasciitis, and that can turn into a major dissection of your arm to get rid of it. That's what they wind up doing. So, and it'll travel; those planes will travel. But also, just as an aside, those fascial things are very good conductors of electricity, and they happen to be part of our meridian system. We have meridians. How energy flows through our body. The Chinese talk about it, the Japanese talk about it. So these meridian systems, a lot of it is fascial. It's part of the fascia. So the fascia is part of the meridian system. But there's that. So anyway, these moving things are moving organs. You have a visceral part, which is on the muscle, and then you have the other part, and you got to put it in there. So, anyway, so that's the heart. The heart has 4 chambers. There's 2 chambers where blood goes in, and there's 2 chambers where blood goes out. The blood enters from the left side. That's the blood, that's the venous blood from all the veins in the body. That's all the blood that has been drained from tissue beds. That has all, the oxygen. It's lacking in oxygen, it's got all the waste products. So it's going back to the right side of the heart. And then it goes down to the right atrium. Then it goes to the next chamber. When the upper part beats, it opens, it goes into the right chamber. The right chamber, when it beats, it goes right into the lungs. And what happens in the lungs? There's gas exchange. All the CO2 diffuses out, all the oxygen diffuses out, and you breathe out the CO2 and you breathe it. So, then that blood goes back into the left receiving chamber, and then into the left ventricle, and then out of the left ventricle, it goes through the aorta. And the aorta separates into all the arteries, the main arteries of the body. So it goes like this, and then down here. You got the renal arteries, you got the hepatic artery, you got the pulmonary artery, and you got the arteries that go down there. So they all come on. Okay, so 4 chambers, 2 receiving chambers, 2 ejection chambers. It's interesting, all the blood that's going through the heart doesn't get to use. That's what I think. That's why on a very first cursory examination, you say, well then how could you have a heart attack? If a heart attack is lack of blood flow, the heart's full of blood, that was fine. All that blood the heart is processing for the body, the heart has actually its own circulation. It's called coronary circulation. And coming off of the aorta is the right and left coronary arteries. And those arteries, branch into smaller arteries, but they take care of it. They feed the heart. So if your coronary arteries, which are little guys, are blocked, then you lack blood flow, and that's where heart attacks come. Okay? The veins in the heart empty through this one area called the venous sinus. It's a sinus. Sinus is just an enlarged vein. And it enters during diastole. And I'll explain that in a minute. Now, we talked about last time in general, we talked about muscles. What did we? Yeah, in general. There are 3 types of muscles, right? Striated or voluntary muscles that we, and smooth muscle and cardiac muscle. I think we touched on it. Smooth muscle is the muscle that's in your GI tract that's making your peristalsis and things that you don't have any control over, you don't know anything about it. That's part of the autonomic nervous system. Striated muscle, which is or voluntary muscle, is it's volitional, right? That is, of course, unless we're of a philosophy that there is no choice, then nothing's volitional. But we won't come to that. Anyway. And then the heart has similar. It has qualities of both. What's unusual about the heart is that it actually is striated. Striated just talks about the fibers, and there are filaments, and filaments have a certain length, and then there are junctions. So where one ends, another one begins, you see a line, and that if you look at it, it looks like fibers with lines in it. Okay. If you cut a what is it that you guys call decayed bovine muscle? Steak. So if you take a look at a steak, and you'll see, you could actually see it's cut this way, and you can see all the little bundles that are probably wrapped in a little fascia thing. So the heart has both that striated, the ability to do harder work, bigger work, striation. And it's got qualities of smooth muscle as well. So, but whereas, have you ever got a twitch, a muscle twitch? That's a one fiber. I'm not one fiber. One. Is it a bundle? It's one. Yeah, the bundle has multiple. I forget what they call that, but anyway, it's one, and it's twitching. Okay, which shows that they can work independently. Like I can. Yeah. Anyway. In the cardiac muscle, each one is got gap junctions, which means holes in them, which allow the ions to flow between cells, so the whole heart functions as a syncytium, or as a unit. Okay? That doesn't happen in this here. Important thing to know. And did we talk about mitochondria at all last time? Probably not. But I think we've mentioned it before. Mitochondria are the little organelles inside of cells that take up glucose and oxygen and produce ATP. And ATP is the unit of energy that the body, that biological systems require. So, if your cell is going to keep the sodium out and the potassium in with the sodium pump, it needs ATP. If your cell is going to divide, if your cell is going to do anything at all other than disintegrate, it needs ATP. ATP is adenosine triphosphate, right? And it's the phosphate bonds are high energy bonds, and as you take off, and so what it does is, anyway, so it's very interesting because it takes energy to make the ATP. So if you think about it, well then you already spent the energy, now you're getting it back. So that's not, but it works out because it takes place in the mitochondria, and the mitochondria are, the process is called oxidative phosphorylation. And oxidative phosphorylation is the production of ATP. So, it uses oxygen. Why? Because oxygen is it's got a lot of extra electrons that we can play with. and that's what happens. So, these mitochondria are responsible for aerobic metabolism, which is different than anaerobic metabolism that we see in funguses, cancer, and certain bacteria. That's a very simple form of metabolism where they grab glucose and without oxygen just run it through a really quick pathway, and they only get 2 ATPs, but they do it faster. Okay, but what is it? Well, you can tell in order to survive, it's going to have to grab more glucose. It's going to need a lot more glucose, a lot more fuel. So that's that. Heart has the most mitochondria of any, more than the muscles. And the muscles, you're always moving around. Because remember, emotion there's a lot of biochemical steps for this to happen. This is not just a simple guy with a string on a lever. It's a big deal, biochemical. And the heart too. So, it has the most mitochondria. One of the factors inside the mitochondria that allow this process to happen, called oxidative phosphorylation, which results in ATP production. One of the things you've all heard of, coenzyme Q10, CoQ10. Take CoQ10. Well, very interesting. So CoQ10 is part of the electron transport cascade. So if anybody knows anybody that's been prescribed a statin drug by trying to think of the appropriate adjective for the people that would actually prescribe those to them. I can't come up with it.
Drug pushers.
So drug pushers is one. But it also goes to, it kind of crosses the line of morality. It crosses the line of morality. Statin drugs poison a certain enzyme system. Wipes out, right, so that your body's not producing cholesterol. Because we've already decided that cholesterol is bad. Now I want you to explain that to God. Explain to God that cholesterol is bad. Does anybody know what cholesterol is?
I know it's in every cell of the body. It's required partly for structural strength.
Mm-hmm.
It's absolutely necessary. Your brain has a lot of, I know it has a lot of fat. It's not a lot of cholesterol.
Cholesterol is considered a fat. It's a lipid. Okay? It's a 4-ringed structure. Biochemical. Our body and every non-plant organism produces it. Okay? So, animals produce it. Plants don't produce it. So, what does it do? Well, it turns out that when it's circulating in your blood and the sun penetrates your skin and it hits that, it initiates a process that results in vitamin D, cholecalciferol. What is one of the things that cholecalciferol does? Vitamin D. One of the things it does is it does several things. Calcium, it's involved in calcium metabolism and all that sort of thing. Bone strength, all kinds of things. But anyway, what that does is it goes to cells that are becoming malignant, cancerous, and it goes in and turns that off. It stops the process, which is why we don't see. It's very rare to find cancer at the equator, and the further you get away from the equator, the higher your incidence of cancer. Vitamin D. One simple thing. So cholesterol important? What else does cholesterol do? I didn't mean to get into cholesterol, but it's pertinent, relevant. Cholesterol also is converted into bile salts. What are bile salts? They allow you to emulsify and fats, oils. Are oils important? Are fats important? Every membrane of your body has a skin called, it's made of fat. So you can either give it trans fats, which don't work, or other rancid fats that you find in potato chips, or you can give it what it needs to function better, which comes from flax seeds and hemp seeds, olives. So if you give it those oils, then it functions really nicely. Okay, so are fats important? Yes. Every cell requires fats for its optimal functioning, or for even its minimal functioning. What else are fats used for? Anyway, it's very, very important. Most of our brain is fat. All the insulation around nerves is fat.
Fat soluble vitamins. You have to have fats with fat soluble vitamins.
Right, some vitamins will stay in fat, and they won't stay in the liquid of the blood, and some will stay in the liquid of the blood, so the water soluble fat. So anyway, it makes bile salts so that we can digest fat. What else does it do? Well, it gets converted into a hormone called pregnenolone, and pregnenolone is the beginning parent of DHEA, cortisol, heard of that? Aldosterone, estrogen, progesterone, testosterone. Are those things important? Without them, the species would not continue. Without them, you'd have no adrenal function. You would not be able to respond to stress. So is cholesterol important? Bad? It's bad. Ask any doctor. Cholesterol's bad. Now, it also is used in membranes of cells and is produced by the liver to protect the cells. So someone who does not eat cholesterol, and there are some of us in the world that don't eat cholesterol, kind of like, I don't know, see if I can name a few. How about Plato, Pythagoras, Newton, Einstein, Gandhi, Henry David Thoreau, Paul McCartney, people that don't eat. Anyway. If you don't eat cholesterol, your body still produces it. Why? Because we need it for that. But we also, it's necessary for stress. It helps it helps prevent cell membranes from getting attacked by oxidation. Oxidation is the basic biochemical pathway of breaking down a system, killing the bacteria. Anyway, we get a lot of oxidation. We eat bad foods. We get irradiated. We sit next to computers. We get all this stuff, and eventually what happens is we have a lot of oxidative products, which are called free radicals, and they're damaging us. So our body produces a little more cholesterol, gives them a cell space up. So your cholesterol is going up. Let's say you're not eating any animals. Your cholesterol is going up. What do? Immediately, let's give you lipids. Let's get rid of that. Look at all the studies for the statins, and you will find that the end point of the study is lowering cholesterol. Does it lower cholesterol? Absolutely. Want to lower your cholesterol? Take this one. Does it prolong life? Not studied. Does it improve quality of life? Not studied. Why? Because a priori, they're assuming that you've already bought the big lie that cholesterol is bad. Anyway, one of the things that statin drugs do is deplete coenzyme Q10. So in Japan, when a cardiologist writes a prescription for Lipitor, he also writes a prescription for coenzyme Q10, because over there it's a prescription drug. We don't do that in America, and I'm assuming it's because we're a free country. I don't know any other reason. Kind of irrelevant, right? So anyway, The heart muscle can also use, it cannot function anaerobically. Other cells can. But it can take fatty acids, it can take glucose, it can take amino acids. It's pretty good at taking stuff and running it up into the, it can even take lactic acid produced by muscles, turn it into pyruvate and get it up into the mitochondria. So, what else did I want to say about the heart? We'll talk a little bit about physiology. There's part of the heart is non-contractile, doesn't move, it's not muscle. And what it has is, its nature is called automaticity. And that is, it has an unstable resting potential. And a resting potential in biology means, like, if you have a cell, the amount of sodium, which is a positive charge compared to the inside, is much higher on the outside, so you've got a positive and a negative differential. Right? And what does that mean? If that cell membrane, the fat, wasn't there, all that positive would rush in to balance out, right? And that's called a potential. That's an electrical potential acting. So, all the cells in our body have stable resting potentials. When they're at rest, unless something does something to it, it's not going to go through its motion. The heart is unstable, and so slowly it leaks. So, in biology, you took out a frog's heart or pig's heart, and it's still beating. You cut them in half, and they're beating. Cut them in half, and they're beating. Automaticity. So, the main pacemaker, the one that initiates the whole beating process, is called the sinoatrial node. And it's located up in the part that receives old blood. There's one other node, the atrioventricular node, which is right down there between these two chambers. And it's connected by this bundle of fibers called the bundle of His. That's the electrical system. That happens automatically. And it happens automatically probably around 120, 130 beats per minute. If we were sitting around at 120 or 130 beats per minute, we'd be breathless. So that's not what happens. So and we talked a little bit last time about the autonomic nervous system. It has a sympathetic system which causes increase and a parasympathetic which slows down. Sympathetic is fight or flight, your eyes dilate, your muscles get blood, your GI tract no longer gets a lot of blood, and you can run or fight. Parasympathetic turns all that off. Your eyes close, and you digest, process food. The two systems. So the heart muscle, the electrical, has an overriding parasympathetic tone, which keeps the normal heart rate under 100. In fact, around average is considered 75 beats per minute. Now, I want you to think about this stuff, because this is pretty amazing. That little thing I call the heart, 75 beats per minute, right? So what is it doing when it's beating? It's contracting and relaxing. Contracting and relaxing. When it contracts, it's called systole. When it relaxes, it's called diastole. Diastole. So at 75 beats per minute, that entire cycle takes 0.8 seconds. It's not a long time, right? What happens in 0.8 seconds?
Contracting a lot.
Yeah.
The blood comes in and goes.
Right. Imagine the blood goes in and is pumped out in 0.8 seconds. How much blood goes in? Well, okay, so you have two ventricles, right? The right and the left. The right goes to the lungs, the left goes to the body. Okay? So the amount that each ventricle pumps out, in 1 minute is called cardiac output. Cardiac output is about 5 liters of blood. Every minute, each ventricle pumps 5 liters of blood. How many liters in a gallon? 3.7 liters in a gallon? Right, so the heart's pumping about 1 1/3 gallons per minute each side of the heart. Okay, now, so there's another term that cardiologists use which is called stroke volume. The stroke volume is the volume of blood that is ejected from the heart on each beat. Okay, that's important to know. So cardiac output actually is stroke volume times heart rate. So what happens in heart failure is the muscle, there are many reasons why, but basically the muscle loses its ability to eject the blood as efficiently. Right? And so in heart failure, what happens is the blood now is not being ejected, so it's backing up. And you see people get swollen legs, or if it's on the right heart and it goes to the lung, they're short of breath.
They're coughing.
Huh?
And they're coughing.
Right, there's all the respiratory symptoms. And so, if it's heart failure, if the left side, the left ventricle, if the left ventricle is sluggish, remember the left ventricle pumps stuff to the body. That means you'll get swollen legs and stuff like that. And if the right side is it, you'll get short of breath, your lungs will be full of fluid, pulmonary. Heart failure is no fun. Now, does anybody have a calculator? Let's see, 5 liters per minute. How many in an hour and then how many in a day?
5 liters.
Yes, it does.
30.
Huh?
30.
300 liters per hour? Is that true? So 300 divided by 3.7, right? We're seeing so about 81 gallons a minute. About 81 gallons a minute. That kind of blows my mind, that each side of our heart is pumping 81 gallons a minute. An hour. It's a lot of work. Now, so when is the heart doing that? Well, we're alive. But it was sleeping. So it never goes to sleep. Does it need healthy mitochondria? Uh-huh. Does it need coenzyme Q10? Uh-huh. Should we take a drug or anything that's going to get rid of our coenzyme Q10? No. And if someone gives us a drug that gets rid of our coenzyme Q10 and doesn't tell us to take coenzyme Q10, have they done us a good service? No. I want you to imagine you take your car in to the mechanic. And he fixes something that's going to result in something else breaking down and the car not working at all, ever again. Would you pay the guy? Would you tell him he's a wonderful man? We have this reverence for the white coat and their ivory towers. Well, the doctor put me on. What is it? I don't know.
Like, what's it for?
I don't know.
It's just for the symptoms.
One time my parents went and they had some kind of testing done, and they injected me with radioactive cyanide in the testing.
Oh, sorry.
When you asked why they did that, no one didn't. Why? I will look at these and do these people.
Right.
That's amazing.
It is unbelievable. You talk about sorcery. Is there another definition? Is there another way to define sorcery?
They have it, they know what they're doing. I don't know.
It's got things saying, I know and you don't, you're down here and you know, trying to be superior and
Well, no, listen. Listen. I'm gonna help you. Here's what I'm gonna do to help you. I'm gonna bring you into a room, and I'm gonna have a guy put a catheter in your vein. We're gonna inject a substance that's so poisonous you're gonna fall asleep. You're gonna become unconscious. I'm going to put a mask on you. Then you're going to we're going to paralyze you so you can't even breathe. So then we're going to stick a tube down your throat so you can breathe. When you're in that state, we're going to crack open your chest. We're going to pull your heart out. And we're going to rip a vein out of your leg, surgically, nicely. And we're going to attach it to that. While we're doing that, we're going to have to stop your heart. Okay? And we're going to stop your heart. We're going to have the blood pumping through these machines. And I'm doing this for your own good. Now, if that's not sorcery, I don't know what is sorcery. To convince someone to undergo that kind of process. But doctor, is there another way? No. Does he know if there's another way? He may not. But if he does not know that there is another way, and it is his role to help people, and he took a Hippocratic oath and said, I will do, above all, do no harm, should he investigate to find out if there is another way? Because when he says no, he should know that it is no. Is there another way? Absolutely. Absolutely. Has coronary artery bypass graft extended life? Does the data show that? What coronary artery bypasses have extended is the cash flow in hospitals and surgeries.
people also have more cancer and more violent deaths when they take statin drugs.
Right, from statin drugs. Statin drugs are... So anyway, I can't help but bring this in. It's so important that you all know this. So that's what the heart does. It does a lot. It pumps a lot. Now, I just want to give you an idea. Are we out of time?
You're at 48 minutes.
Huh? 10 more minutes? Okay. I just want to give you another idea of the physiology of the heart, how it works, so you can understand what affects it. There's this phenomenon known as preload. Preload is, you imagine you have heart muscle like this, right? So when it gets during diastole, which is that part of the cardiac cycle where the heart's at rest. Remember, systole is contracting, diastole is relaxing. So during the point of relaxation, it has to fill up with blood. So as it fills up, these muscles are stretched, kind of like a rubber band. That's called preload. It's kind of loading it. And then it contracts. Okay, you understand? So preload is the volume of blood entering the ventricle, producing stretch, which produces the ability to eject, right? So the bigger the preload, the bigger the ejection. The less preload, the less the ejection. So we don't want to diminish our preload. We need to get enough blood in there so we can get enough blood out. Well, what diminishes it? Well, one obvious thing would be hemorrhage. If you were hemorrhaging, bleeding from somewhere, you couldn't get, there's enough to be blood. So the other one is dehydration, severe dehydration. Because dehydration refers to water, and the largest component of blood is water. Okay. So when you're dehydrated, you have less blood volume. So what do you do? What do we do when you're dehydrated?
Drink water.
Drink water. And what if we can't drink water? What if you're nauseous? We give you an IV. We just put in not water, it's close to something. No one will say anything. So the preload, very important. Now, when the heart pumps, so what else is involved in the cardiac cycle? The amount of blood that enters, the ability of this heart muscle to contract. So remember, if you've had damage to that heart muscle from having heart attacks, or if it's metabolically compromised because you eat a lot of poison, it won't work well. A lot of things, there's a thing called cardiomyopathies, which are a class of diseases. I have to do this. There are no diseases, but a class of what they call diseases called cardiomyopathies, where the heart muscle, is actually damaged, and it's thought to be due to a virus. And one of the viruses that's been implicated is the Coxsackie virus, and in what they call cardiomyopathy. And they have what's called idiopathic cardiomyopathy. Idiopathic means we don't know the cause. All right, what does idiopathic mean? Doctor's an idiot, patient's pathetic. So the three things involved in a good, healthy cardiac function, the cardiac cycle, is the preload, the ability to contract, and the afterload. What is the afterload? The afterload is the resistance is pumping again. So in a garden hose, if it's a thin hose or a wide hose, and then you look at flow characteristics. Well, if it's a wide hose, I'm going to get more water, but less pressure, right? Because the thinner the hose, it puts pressure. So the same thing. So we have our aorta and our arteries, and they are elastic. They have elastic material. So they function just like the heart does in preload. Okay? So now what happens if this gets hard and stiff? The arteries. The heart's got to what do we get? High blood pressure. What's one of the reasons for high blood pressure?
Well, we used to call it hardening the artery.
Right, that's what source. Now how do we get that? Why both calcium and harden? Why? Because we're eating corpses, the fat around their organs. But you need it. You need